Let me welcome you, Dr. Leonard. Thanks a lot for joining us today. I know you've got just a ton on your plate throughout the hospital system trying to keep us all safe, but maybe kick it off. Can you give us an overview on the COVID-19 situation here in Northwest Indiana? Are we seeing the kind of increases here that we're seeing elsewhere in the country?
Yeah, first of all, thank you. I really appreciate the opportunity to be here and to speak to the issues here. Short answer, yeah, we're seeing those numbers. Within the last few weeks, the state of Indiana has ranked from 8th to 10th in the nation on case prevalence. And then if you look at the Northwest Indiana region, the counties around here, you take them as a whole separately, the case prevalence is even higher. We're among the highest case prevalent counties in our state. So when you look at those separately as compared to national numbers statewide, we are among the very worst in the entire nation as far as case prevalence goes. When you look at our county specifically, we are typically in a red level state or condition, and what that is referring to is basically they're looking at case prevalence, and two factors that they're looking at. One is the 7-day positivity rate. So basically a 7-day look back of among all the patients and folks that you have tested, what's the rate of those with which are positive? That's your 7-day positivity rate. The second factor that's considered is the total active number of positive cases that you have per 100,000 residents. So you factor those two pieces together, and that gives you your overall severity level. And typically our counties here in this area last few weeks have been running in and out of the red level state. So very high case prevalence here in our area.
There's been some comments or thought process that there's a number of people that are showing mild symptoms and perhaps maybe we don't need to take it as seriously. How does the number, it all ultimately comes down to hospitalizations. How does the number of hospitalizations now compare to what you might have seen in the spring?
Right. So when you're looking at this case prevalence as it is, there's more folks in our local area that have disease, that are sick. And among them, you're going to have a subset that have severe illness that requires hospitalization. And so here we are. Right. The numbers that we're seeing now compared to what we saw back in the spring, our daily admission numbers are 8 to 9 times that they were back in the spring. So we are by far eclipsing the numbers that we were seeing before. Another way of looking at it, when you look at our entire hospital capacity, all patients admitted to the hospital in the 3 hospitals that we serve, that we provide services through, there are 1/3 of the total population of admitted patients are COVID positive. So very high numbers.
Are the hospitals right now in a situation where they're actually turning patients away?
No. We're not turning patients away. Anybody that is in need of medical care that requires hospital admission is going to be admitted. But that is the concern. When you look at the current surge of cases that we have, of all those requiring hospitalization, we are at a state of full capacity, most commonly. And with that, we are applying our surge and capacity management plans that are accommodating these patients and working and getting them safely put through their hospital course to get to the state of a safe discharge, to open up beds for more patients. So we're doing everything we possibly can right now to provide those beds safely for the patients that need hospital admission. But you can imagine that if we don't get a handle on this current rate of positivity, the numbers are going to continue to rise. And you can imagine it's very possible that we are going to get to a point where the total number of patients requiring hospital admission can exceed our resources and our bed availability to accommodate all those patients. So it's incredibly important now that we do start to have more conversations about flattening the curve. We have to reduce the number of total case prevalence in our area so that we are seeing less patients needing to be admitted.
What ultimately determines whether a patient has to be hospitalized once they are confirmed tested?
Yeah, so when patients are in need of medical care that cannot be provided for at home, that's when they need hospitalization. By far, when COVID is at its most severe state, it's affecting the lungs and lung function. Patients come in very short of breath with low oxygen saturations in their bloodstream. That's not compatible with life. So the need typically is to admit to get the oxygenation levels back up and to perfuse the lungs and allow for improved lung function so patients can survive. But it's not lungs alone. There are many other organs that decompensate, and you have many other organ dysfunctions that really can also be cause for admission to the hospital as well.
During this time, are tests being done, or is lab work being done? Can patients still come to the ER for any critical needs?
Yeah, absolutely. Urgent care centers, emergency departments, clinics, offices, labs, they're all open and they're all here and safely prepared to accommodate our patients and on all of their needs. It is very important to send the message home that you shouldn't be delaying medical care. Get to your doctor, keep those regularly scheduled appointments so you can manage the underlying medical conditions that you may have long term so they do not decompensate. When you have urgent care needs, emergent care needs, it is safe to get to those sites to get the care that you need. Please don't be afraid to get out, to get to those areas to get the medical care you need. Better to be stabilized now than to wait for your condition to become more severe in the near future.
That's an awesome point. Drill for me now at the very end, just what are the reminders, once again, that we can do to try to stay safe and limit the rise of these cases?
So yeah, the key point here is we definitely need to flatten the curve. Our numbers are extremely high. Our admission rates are extremely high. We are approaching a point where our resources are going to be overwhelmed by the number of patients that require help. So we absolutely need to flatten the curve. How do you do that? We got to reduce the number of patients, the number of people, residents in our counties that are sick at the same time. The only way to reduce spread and to reduce illness is to wear your mask, stay at least 6 feet apart, meticulous hand washing, and wash your hands often, avoid crowds. Please continue to do these things. You know, there's a vaccination that's coming. There's a lot of talk about that, right? And when it's coming and when is it going to get here and who's going to get it first and all of that. The vaccine alone isn't going to be a silver bullet. It isn't going to end this for us. We need the vaccine and we need all of these other precautions to be in place and adhered to for us to finally break the spread of this disease. So please, everyone out there, do everything you can to take care of yourself. Do the right thing. Make those critical decisions to be safe. If we all can do that, we will lower our case prevalence. And therefore, we will have less patients at the same time requiring hospital admission. Then we're going to be able to care for our patients, all patients that are coming in for seeking medical care.
I think you hit the nail on the head with do the right thing. And ultimately, those are the principles that you guys have been preaching. Many of the other medical officials throughout the country have been preaching. And we want to help you spread the word on. Mask up, stay distant, wash your hands, be safe. You know, don't go into large crowd situations. Ultimately, do all the preventative things now to protect yourselves and those around you.
That's right. These measures do work. If there's enough of us sticking to our guns, following these rules, we are going to stop this the spread of this disease.
Well, thank you very much for taking the time today. We appreciate you and the thousands that you're working with and the rest of the extended medical community throughout the region. It's impressive as heck what you guys are doing to keep all of us safe while you're putting yourself in a vulnerable position. I commend that. I thank you for it, and may all of us follow your direction.
Well, thank you very much for that. I really echo what you say. We have so many excellent nurses and doctors, healthcare workers here that are doing all that they can, working hard every day, putting themselves at risk to care for all these patients. They are a precious resource, and we need to protect them. We cannot exhaust them for the sake of all those patients that are going to need their care in the future. So a shared immense sense of appreciation, and thank you to all who are there doing all that they're doing every day to care for these patients.
Absolutely. Stay safe, and thanks for keeping us informed.
And thank you.